DJ Elvers. Welcome to DJ's Dish. I want to talk to you today a little bit about my bag. I know it looks really huge. I get teased a lot about it, but this is what works for me in home health. You know, Maxim has got a wonderful novice program now where we're taking in graduate nurses and teaching them what it's really like to be working in somebody's home, which is so different than working in a hospital or a nursing home. So I thought as I was cleaning out my bag, it might be a good idea to just go over, because it took me quite a while when I started working in the home to get very contained, to know that I had everything that I need. I'd like to just go over a couple of little things that I have in here. I always carry some tissues with me. You don't always find those. Always take some breath mints, because you don't know how close you're going to get to people. I even take a little dental floss, and of course our hand sanitizers, and a little cream for your hands, because that often is what you need after you've used these hand sanitizers. In here I always carry a mask. Sometimes I just get an allergy attack and I don't want to be sneezing all over my families and patients. I also always have some hemostats, some scissors. I carry several pens, exactly the same. In case one runs out of ink, I can then go to the next one, and then I have one that's a little bit darker. I carry a pen light, because you never know when somebody's going to bonk their head and you want to do a neuro check. So I think that that's good too. And then I always have a little booklet for myself that I can just make a note, bring this or don't forget that, or sometimes it's just, you know, stop on my way home and get milk. But this way I have it and I don't have to be looking around for paper. This is something that I want to share with everybody. This comes under several different names. You can buy it in any department that sells bandages, in pharmacies or in supermarkets. And what this is something that sticks to itself, as you can see, but does not stick to anything else. Many of my patients have feeding tubes, and we kind of nicknamed feeding the bed, because sometimes the feeding tubes, well, with the little med port, it will pop open. Sometimes the little ones pull it open themselves, and sometimes they just roll over on it. If you find that that's a problem, you can take this, wrap this around the end of the med port, and you will not feed the bed. This has saved me many, many times. Then we kind of move on here. I am not terribly computer savvy, so I like to have with me a drug handbook. This way, anything comes up, I can look it up, and I can read all of the nursing considerations, which I think are very important. You don't always get that online. Also, for Maxim nurses, I always carry some cardboard that I can put in the chart, so that when you're writing, you don't have to spread the whole thing out. You can keep it folded over, and you're not going to be writing on the copy that you have. I also take care of mostly children, so I like to carry with me some icebreaker books. Sometimes I'll go to a new family and they might not have this kind of reading material. I just take these, just as I say, as a little icebreaker for the little ones. And speaking of my little ones, I also like to do little things like, I have one patient whose favorite color is orange. When I go to that house, I take an orange stethoscope. If I go see a little girl, I will take a pink stethoscope. I don't carry these with me all the time, because I know where I'm going when I head out. And then I have, for everyone else, a black stethoscope. But I like the children to feel like this is yours, this is to take care of you. And then any anticipation just goes away. They're very comfortable with that. I also carry some gloves. My hands are kind of small, and sometimes the gloves in the home are too big for me to really work with, so I carry some of my own gloves. Then I have found, any time of year, sometimes the floors get cold and most people will prefer you to take off their shoes, so I always carry some extra warm socks with me, just to make me a little bit more comfortable. I'm sure that as time goes on, everyone finds what works best for them, but this is what works for me, and maybe some of these things will help you out, because all we want is for you to be able to be the face, the smile, the hand, the touch, the heart and soul of Maxim. Thanks for joining me, and I hope to see you next time.